topic for discussion now is wounds and wound healing. Understanding about this wounds and wound healing is very important because we encounter as physicians or as an oral physician or a dentist, we commonly encounter with this various, wound is nothing but a damage to our break in the integrity of skin or mucosa or any other tissue. So all the procedures that we actually do, or the cases that come to us usually are, most of them are wounds. Like it can be either a normal incision, or it can be an open wound, or it can be a fracture leading to laceration of the mucosa, or extraoral lacerations such as lacerations on the face, etc., contusion injuries. These are more different kinds of wounds, and understanding how these actually heal, by what intention they heal, by what mechanism they heal, the process of healing is, understanding this process of wound healing is important, because by identifying any disruption in any phase of this wound healing, we can actually come to a proper diagnosis, and also will be helpful in treating that cases. So now we will be discussing about wounds and wound healing. Actually, wound is nothing but whenever there is a break in the integrity of the skin or tissues, often which actually may be associated with disruption of the structure or the function. Healing actually means nothing but replacement of this lost or dead tissue with a living or viable tissue. This is nothing but healing. So we have various etiologies for wounds, as we all know. They can be, most common etiological factor is trauma, where traumatic injuries are very common, and other agents like physical agents, chemical agents, microbial agents, physical agents like radiation injuries, heat injuries, electrical injuries, electrical wounds like shock wounds, etc. And then chemical agents such as acids, or any caustic agents. These all are chemical agents which can cause wounds. We have various microbial agents such as fungal infections, bacterial infections, which can cause open wounds sometimes. These are various types of agents like physical, chemical, microbial, trauma agents which can cause wounds. Another very important one is ischemia. In this ischemia, what happens is there will be block of the vessel and of the blood vessel, which the tissue that has to be supplied with this blood vessel will be hypoperfused, will lead to ischemia, localized necrosis, and there can be a wound there. So this is also one kind of wounds again. Now, when we're talking about healing of wounds, we actually come across three specific terms. One is regeneration, reconstitution, and repair. So what is this regeneration? Regeneration is nothing but replacement of the lost tissue with similar type of tissues which are present around that. Similar type of specialized tissues, what they do is they actually reproliferate again and then close the wound or heal the wound. This is called as regeneration. We actually see regeneration in case of amphibians, etc., where instead of regeneration, reconstitution we actually see in case of amphibians, etc., where the whole organ, especially the tail, etc., is completely formed again. So reconstitution is nothing but reformation of the whole organ of the body with the help of a coordinated regeneration. Here what happens, there will be a coordinated regeneration of several types of lost tissue. That is nothing but reconstitution. So reconstitution and regeneration. Regeneration is nothing but the lost tissue is replaced by the similar type of tissue which are present with the help of specialized cells that are present adjacent to the wound. Reconstitution is a mechanism where there will be reformation of the whole organ or limb with the help of coordinated regeneration. Next is repair. Repair is replacement of this lost tissue with granulation tissue. With the help of granulation tissue, which is again followed by fibrosis and scar formation. This is repair, and most of the wounds usually heal with this mechanism, that is repair mechanism. Example are nerves and muscles, usually repair instead of regenerating. Now coming to types of wounds, we have various types of wounds which include incised wounds, that is where a neat incision is given, lacerated wounds where there will be scraping of the superficial tissues, penetrating wounds or stab wounds where there will be deep cuts or deep injuries, and we have crushed wounds where the tissue is completely crushed. This is called as these crushed wounds. So again various types of wounds. And based upon the thickness of the wound also, we have various, again a classification of wounds. One is superficial wounds, where a superficial layer of epidermis is involved. Coming to partial thickness, where a specific thickness of epidermis is involved. In case of full thickness, complete epidermal layer is involved there. Coming to deep wounds, what happens is epidermis, dermis, and sometimes the hypodermis also is involved in case of deep wounds. Next we have complicated wounds. Complicated wounds will sometimes can have foreign bodies along with them, and also infectious agents which are present within the wounds. And we have penetrating wounds or stabbing wounds, where the source of the injury, maybe the knife or etc., the source which is present can go deeper into the tissues, which is called as penetrating type of injury. Now coming to surgical wounds, there is again a classification of various surgical wounds which include clean wound, where a clean incision is given. This is called as clean wound. We have clean contaminated wounds. For example, in case of incision and drainage, what happens? It is already an abscess where there is pus collection at some place, and also ulcerative lesion around it. So when we are giving an incision, in that cases, it is actually a clean incision but also has a contaminated pus microorganisms in that area. You have contaminated wounds, and we have dirty infected wounds, especially in case if the equipment that is being used is unsterile, or the environment that is being present in the hospital environment is unsterile. In those cases, what happens? We can see dirty infected wounds. Now coming to wound healing. Wound healing actually happens by two mechanisms. One is healing by primary intention, and second thing is healing by second intention or secondary intention. Healing by primary intention is usually seen in case of clean incised wounds, and in secondary intention is usually seen in case of open wounds. Now coming to wound healing process, what happens? The procedure of this wound healing mechanism usually involves 4 stages. One is inflammation. After that, you will see wound contraction, and then we see epithelialization at that area and granulation tissue formation. And in this picture, we can actually say the initial stage, whenever there is an wound or whenever there is a trauma that has been happening, in within 5 minutes of time, we see vasoconstriction and coagulation phase happening there. And within next 30 minutes, what happens? We see vasodilatation. In this vasodilatation condition, what happens is there will be influx of the polymorphonuclear neutrophils in that region, which has predominantly seen are neutrophils there. And within 24 hours, the inflammatory phase happens there. The inflammatory reactions start, especially with predominance of neutrophils in this region. Later, after 48 hours, what happens is within 7 days, instead of neutrophils, we see macrophages as predominant structures there. Fibroplasia can be seen there with granulation tissue formation, and angiogenesis happens almost within 7 to 14 days. What happens is new blood vessels formation happens, and this is the phase where actually the contraction of the wound starts within this 7 to 14 days of time. After this 14 days, or that is almost 2 weeks of time, there will be maturation and remodeling of the wound, and finally scar formation can be seen within almost a 10-week period of time. So this is how the process of wound healing actually happens. Here we see a case of hand abrasion, where initially at the the 0th hour, we see a hand abrasion there. Within 3 days of time, what happens is there will be vasoconstriction, coagulation phase, and inflammatory reaction is usually starting there. Here in the picture, we can see within the 17th day, approximately within 17 days, we can see contraction of the wound there. The size of the diameter of the lesion has been decreased here in the third picture, and by end of the 30th day, we can see a scar formation. This is how actually with the help of epithelialization and granulation tissue formation, there is a scar formation there. So this is the process of wound healing, where in the mechanism of wound healing, we see inflammation, wound contraction, epithelialization, and granulation tissue formation. Now coming to inflammation. In the first phase of inflammation, what happens? As we see immediately after the injury, vasoconstriction and vasodilatation phase, after hemostatic plug, while in the process of formation of hemostatic plug, there will be inflammatory procedure which has been starting. In this inflammatory procedure, it calls for the infiltration of the polymorphonuclear leukocytes, neutrophils there. Along with this, we see various other mediators, chemical mediators there. That is, chemically mediated amplification cascade happens with the help of histamine, kallikrein, kinin, bradykinin and prostaglandins and leukotaxin there. Here, in this whole phase of inflammation, initial stages, we can see granulocytes and monocytes predominating in the initial phase of inflammation. Now, in this flowchart, we can actually see immediately after the tissue damage, there are platelets are present, platelets have been aggregated there, and addition of platelets happened with aggregation. An intrinsic pathway and an extrinsic pathway cascade starts again, the coagulation cascade starts forming a fibrin mesh, and with this formation of fibrin mesh, there is release of thromboxane and serotonins, and finally what we see is there is nice tissue remodeling happening with collagen realigned along with the tension lines of the incision or along the tension lines of the wound there. Completely remodeled tissue with or without scar formation can be seen based upon the type of wound, whether it is a primary, whether it is a simple incised wound or an open wound. Based on that, we can see whether the tissue heals with a scar or without a scar. Now, coming to the various chemotatic factors for neutrophils, we have histamine, serotonin, kinins. These usually causes the vasoconstriction, especially the thromboxane. There will be decrease in the blood loss in the initial stages, and these also act as a chemotactic factors for neutrophils. And these are usually seen abundant in number in initial 24 hours period. We can see them in abundance. Later, these neutrophils removes the cell debris and they further release cytokines. These cytokines actually attracts the macrophages. Once the macrophages are being collected within the area, now we also see fibroblasts which migrate into the wound and this secrete collagen type 3. Within 48 hours, we also see angiogenesis there, that is production of proliferation of new blood vessels there, minute very friable blood vessels can be seen, and there will be secretion of collagen, macrophage remodeling and secretion, and this angiogenesis will be continued up to a period of 3 weeks. The greatest increase in wound strength occurs during this phase of these 3 weeks, where with the help of collagen, macrophage remodeling and angiogenesis will strengthen the wound healing process, and this usually takes place up to 3 weeks period of time. Now we are coming to wound contraction. Wound contraction is usually seen in case of open wounds and usually heals with the help of secondary intention, and this starts immediately after the vasodilatation phase and at the start of inflammatory phase. Usually it will start between somewhere around 3 to 4 days after the injury. We have an initial lag period, that is before this 3 to 4 days there will be a lag period will be present, and after this 3 to 4 days of this tissue injury we can see the lag period. After certain period of lagging, we actually see the rapid contraction phase, which usually happens by 14th day, where the size of the lesion, especially the diameter of the lesion, is being constricted in this region. In case of the wound healing process, in any case of inflammatory lesion, there will be centripetal movement of the wound closure, that is from the periphery, the tissue, the granulation tissue from the periphery proliferates and then it comes towards the center. This is nothing but centripetal movement in case of wound closure. Now when you call various causes of this wound contraction, there will be remolar fluid, contraction of collagen, where approximately after 8th day of healing, collagen starts contracting. So because of this contraction, what happens? It pulls the edges of the wound, thus there will be contraction of the wound again. There will be contraction of the granulation tissue, and this contraction mechanisms are usually located in the margin of the wound. That's why when we actually see the wound, it appears like a picture frame area. Especially myofibroblasts which are present at the periphery of the wound helps in case of contraction of the wound again. Now, what are the various factors that actually inhibit this? The various factors that inhibits wound contraction. One is corticosteroids. Corticosteroids delay wound healing. Next, any burns. In case of burns, also there will be delayed wound healing. X-radiation, trospium, immediate skin grafting, colchicine, wind blasting and other cytotoxic agents also will cause will inhibit wound contraction. Now coming to epithelialization, usually epidermis thickens on the first day itself. Within 48 hours, what happens? There will be re-epithelialization seen. The marginal basal cells, they actually migrate into the wound and start proliferating, resulting in re-epithelialization. There will be formation of epithelial layering. Once the basal layer is formed, then epithelial layering can be seen and there will be keratinization at the end of the epithelialization phase. In case of granulation tissue formation, what happens is here new capillaries and fibroblasts are formed. As we have seen earlier, what happens? Neoangiogenesis is happening. There is angiogenesis is happening. Along with angiogenesis, fibroblasts are being migrated into the wound, especially the myofibroblast and also the fibroblast are being migrating into the wound. Thus, this will cause a granulation tissue formation. Formation of granulation tissue is usually preceded by two phases. One is phase of traumatic inflammation. As we have seen, it is by chemically mediated amplification cascade, and phase of demolition, where cytolytic stage can also happen in case of demolition. This granulation tissue formation occurs in two phases. One is phase of vascularization and phase of devascularization. In phase of vascularization, what happens is there is organization of growth and ingrowth of capillary roots and fibroblasts are seen in case of this phase of vascularization. Vascular arcades formation is seen along with the fibrogenesis. Here what happens is tropocollagen and reticulin fibers are more predominantly seen. There are three types of collagens usually seen in these cases. One is type 1 collagen, usually seen in case of tendon, ligament, bone and skin. Type 2 collagen in cartilages. Type 3 collagen in fetal dermis, aorta, esophagus and uterus. Whenever there is wound healing procedure, type 3 collagen is one of the collagen that is most predominantly seen in wound healing. Now coming to phase of devascularization, what happens is once this phase of vascularization has been completed, in phase of devascularization there will be atrophy of your blood vessels. Atrophy of vessels with endarterectus obliterans. There will be pale colored granulation tissue. Remember, in phase of vascularization, the granulation tissue is nice pink and red in color, whereas in case of devascularization, the granulation tissue is completely pale in color. This is because of atrophy of the blood vessels. At the start, what happens? Lymphatic tissues and nervous tissue form here in the start, and cicatrization and scar remodeling occurs at the later phases. Remember, in case of any deep wounds, especially the sebaceous glands and hair follicles will not form in case of, whenever there is wound healing, these are not being regenerated again. Now coming to tensile strength of the wound. Tensile strength of the wound is something which actually is a safeguard of the wound without dehiscence. Normally the collagen tissues, the blood vessels which have been newly formed are very friable. However, the tensile strength of the wound is something which is actually safeguarding the wound which has been healed without dehiscence. It actually corresponds to the amount of collagen that is being present here. Good amount of collagen, more is the tensile strength. What are the factors that have been affecting this tensile strength of the wound? Now we have various factors which includes direction of the wound, pull of underlying muscles. If the pull of underlying muscles is more, then there is more amount of dehiscence, and the wound requires more tensile strength for preventing dehiscence. So if the pull of underlying muscles is less, then tensile strength of the wound is good. If there are any previous wounds or abdominal binders, these also will affect the tensile strength of the wound. The other factors which are affecting granulation tissue formation, scurvy, vitamin C deficiency, which has its effect on collagen. As we know, granulation tissue formation requires collagen formation, and if in case of scurvy, what happens? Collagen tissue formation is inhibited or prevented, or collagen tissue formation is impaired in case of scurvy, thus it affects granulation tissue formation. Protein formation, corticosteroids also affect granulation tissue formation. Now coming to healing of skin wounds. In healing of skin wounds, especially in clean incised wounds, it heals by primary intention. The time taken for this wound healing is very less, as the edges are very closely approximating each other. This heals by primary intention and or first intention, and normal suturing of these two incised edges will promote healing faster. No separation of wound edges is seen in this, and even the scar formation is also very minimal in these cases. Now in case of primary intention, the phases of healing includes initial hemorrhage, fibrin-rich hematoma is seen in these cases, acute inflammatory reaction by infiltration of polymorphonucleosides can be seen, organization of the wound and regeneration of the epithelium can be seen. In case of open wounds, what happens is the deep layers are closed there and the edges of the wound are at a distance, are apart. So in these cases, what happens is it cannot heal by primary intention and it requires a secondary healing, that is healing by second intention. It is usually seen in cases of infection, excessive trauma, tissue loss or imprecision approximation of tissue. The phases of wound healing by secondary intention include initial inflammatory phase and scab formation. So whenever the wound edges are at a distance, the center, there will be scab formation between the two edges of the wound. Wound contracture phase occurs in this. So the edges are being pulled towards center with the help of centripetal wound contraction. Granulation tissue phase happens here where collagen fibers, angiogenesis happen and re-epithelialization happens at the last. What are the factors that are affecting this wound healing? There are two factors, as we all know, local factors and general factors. In case of complication of wound, they have implantation cyst, painful scars, cicatrization, keloid formation are other complications of wound. In this picture we can see keloid formation. There is excessive scar formation, more amount of collagen formation, and the tissue is been actually popping up from the surface of the skin. Okay. And we have other complications such as desmoids or aggressive fibromatosis. These are nothing but exuberant proliferation of fibroblasts and other connective tissue elements. And formation of contractions is also seen as a complication of wound healing. Now, coming to conclusion, as we have already at the beginning of the lecture itself, we have seen why understanding wound healing is important, because knowing the pathogenesis of disease is very important, because satisfactory wound healing is ultimate goal of any surgery, right? After any treatment, one always think about satisfactory wound healing. Let it be a healing by primary intention or healing by secondary intention. So to have that better outcome, understanding the sequence, understanding the pathogenesis of wound healing will help in better outcome. So this is all about wound healing and various types of wounds, and how wounds of both incised and open wounds heal by both primary and secondary intention. We also have discussed about the complications. So this is about wounds and wound healing. Thank you.